And so what, in your opinion, can health managers do to create a positive working environment for female providers in remote communities such as this?
So thank you, Angela. I think one of the things that the health managers could do is one by developing a feedback mechanism. Because in our work, we realized that most of the female health workers, they were not willing to open up on some of the issues that they were facing, largely because the people they would have opened up at the facility level were male, who were the facility in charges. Most of them were male. Most of the colleagues at the health facility were male, so they actually kept to themselves. And I feel that if the health managers could develop a clear feedback mechanism, then it would be a good strategy to ensure that the female health workers, they air out what they are feeling, they air out their views. Maybe they could even air out some of the feedback that they have regarding the work that they are doing. The other thing is around motivation. And in the larger Mandera County, you realize that in very few facilities have female in charges, facility in charges. And this means that the work of the female health workers is reduced to just service provision. And with the feeling of the communities that the female should not be in leadership position, then this is actually, it impacts more negatively on the female health workers. So I feel that if the health managers could probably ensure that there's more motivation, because in my interaction with most of these female health workers is actually that they were willing to take up the leadership roles if they were offered to them. So I think if the health managers could take that as an initiative, that would be a good motivation to the female health workers. The other thing is around strengthening the structures of the facilities, because actually in all the facilities that we worked with, we realized that none of them had things like staff quarters. And most of the female health workers felt that working in these facilities, which were quite far from where they were living, and sometimes attending to night calls and night duties, it meant that it was more insecure for them as they were traveling back to their places of work. So I think that if the health managers could ensure that the health structures are strengthened, and then they build things like staff quarters, which are equipped with water, good electricity, available electricity, then this would actually be a good thing to create a positive working environment for the female providers in these remote communities.